Welcome everyone. You may recall Dr. Brent Blue from a couple of previous videos. Dr. Blue, thank you for talking to me again.
Thank you, Martin.
Today we're going to talk about a topic that I have no personal experience with. I hope I will never have personal experience with it. Specifically, what we're going to talk about is what drug use, alcohol can do to a pilot, to the medical situation, and how pilots can remedy that and get flying again. Let's talk first maybe about what is the way to get into trouble here. It's not an occasional beer every now and then, right? I'm guilty of that.
Right.
What specifically does a pilot need to avoid?
Well, first thing is let's talk about alcohol, because that's the one that's most straightforward. Any pilot who has an alcohol problem is supposed to report that to the FAA. But the far majority of pilots who have an alcohol problem that get involved with the FAA usually occurs after a driving while intoxicated, a DUI. And when that happens, the pilot has to report that to the legal department in Washington, D.C. If they don't report that, they can actually lose their certificate, not just their medical, but their actual pilot certificate, and in order to fly again, have to restart and do all their certificates. I mean, literally start with a private pilot exam again. That's the most common way. Some pilots will self-disclose on their medical that they've been in treatment or that they go to AA, but that's a more of a voluntary disclosure. And since the most common symptom of alcoholism is denial, most of the time it's some interaction with the legal system that gets pilots involved with the FAA as far as alcohol. If there's a one-time offense, like if somebody gets a DUI and they blow, say, a .09, usually the AME can issue the medical if it was a one-time event, there were no extenuating circumstances, there's no previous history of alcohol issues, the AME is supposed to do a pretty decent investigation. If the pilot blows .15 or above, regardless of whether it's their first or not, they have to be investigated, because if they blow .15 or above, they're basically showing tolerance to alcohol. And most people would be pretty incapacitated at .15. And if you could be driving a car at .15, the FAA feels like you need to have further evaluation. And that evaluation may be a drug and alcohol evaluation. It may be any medical records that you might have that might be related to alcohol or drug issues. Character statements from your minister or rabbi or other people like that. They may require even a rehab if the situation shows that you really do have an ongoing drug or alcohol problem. And most of the time, if the pilot complies with all the things that they ask, they can get their medical back, but they may end up having to be monitored. And monitoring is done by what's called a HIMSS AME. HIMSS stands for Human Intervention Motivational Study. It is what was originally studied, was the name of the study that originally used to get airline pilots back in the cockpit after alcohol problems. And they've just kept the names. And so there are AMEs like me that have to go to a special course to be certified to be a HIMSS AME. A lot of times what we end up doing is we do drug and alcohol random testing for like a year, 2 years, 5 years, depending on the situation, where we notify the pilot on a random basis that they have to get an alcohol test or a drug test. It really depends on the situation. It can be very individualized in this setting. And so that's generally what happens with the alcohol issues. Drug issues are a totally different thing, because a lot of it depends on the type of drug and the severity of the issue. If somebody has turned up positive on some kind of drug test for marijuana, that's not going to be as serious as turning up for heroin or cocaine or methamphetamine. But they end up in the HIMSS program as well if they want to get their medical back. And they will be evaluated on a much stricter basis. They will also be followed on a much stricter basis than the alcohol people are in a general sense. But people can get back into the cockpit after those issues. But it's important for people to remember too that alcohol can be an issue even when people are not drinking. You probably have heard the expression dry drunk. people who consume a lot of alcohol on a regular basis, even if they've had no alcohol within 24 hours of a flight, can still be affected by having consumed large quantities of alcohol in the past. And that is something the FAA is very, very concerned about. Of course, I mean, drugs are drugs, and if pilots are taking illicit drugs, the FAA is not going to be a happy camper about that. There are prescription drugs, like prescription opiates, that people take for low back pain or whatever, and they can take that, but they can't take that while flying. And they basically can't take, like if they're taking Tylenol with codeine or hydrocodone for low back pain, they can't take that within what are called 5 half-lives of the medication. So if the medication is prescribed every 8 hours, that means they can't fly for 40 hours after taking the last tablet. And that's important for pilots to remember.
Mm-hmm. From what I've heard, there's a connection possibly between alcohol problems and mental health issues. Is that correct? And does that affect pilots?
Well, that's correct. I mean, a lot of pilots use alcohol to treat depression. It's a horrible drug for that, but they do that. And many times the real problem is depression, and that depression either needs treatment with counseling or treatment with medications. And the HIMSS program also works with pilots who have to be on antidepressants. There are 4 antidepressants that pilots can be on that are approved, but they still have to go through a significant amount of evaluation by the FAA that may include evaluation by a psychiatrist, evaluation by a neuropsychologist. It may involve having to do a cog screen, which is totally stupid, but I won't go into that. But there are things that the pilot may need to do, but the important thing is that, you know, I would much rather fly with a pilot who's depressed and under treatment than a pilot who's depressed who's not under treatment. And so the issue of why somebody is drinking as much as they may be drinking is important to figure out what is the underlying issue here. And is this pilot really self-treating a depression issue as opposed to just, you know, enjoys drinking all the time? Mm-hmm. So that HIMSS program is one of those things that can be very, very important.
So it sounds like, as embarrassing as it may be to confront it and talk to somebody, to an expert about the issue at hand, that is probably the key to understanding what is the root cause and what is the best way to treat it, to mitigate it, and make sure it's not a problem for flying.
Well, that's correct. And I mean, basically, if somebody has had an alcohol problem, they have to be totally abstinent from alcohol, period. There's no leeway. There's not 1 drink a week. It's like 0 alcohol. Mm-hmm. If there's a drug issue, obviously that is an issue that is a 0 tolerance program as well. There can be no drugs or alcohol in those settings whatsoever. Right. So somebody who wants to keep flying who's had an alcohol problem is never going to drink again. Mm-hmm. And that's just the way it is. It's either flying or drinking. And fortunately, most people, you know, choose flying and stop drinking.
And in the end, that's probably not just good for flying, but for life in general.
Well, it is definitely good for life in general, because alcohol is really definitely the most abused drug in the United States, and causes a huge number of problems, not just in aviation, but in domestic situations and work situations.
Mm-hmm. Well, best case scenario, what you heard today in this video will never be of importance to you, but if it is, maybe you take comfort in, you know, that there is a way to help with the right attitude and the right guidance. And Dr. Blue, thank you for
Brian.
Talking to us today.
Pleasure.
And thanks for watching, and see you soon in the next video. Bye-bye.